Today the Biden administration announced $49 million in grants to help community groups sign more families and children up for health insurance, especially the more than half of the country's 4 million uninsured children who qualify for free coverage through Medicaid or CHIP, the Children's Health In. So many children, even though they're eligible, don't know it. Their parents don't know that they are eligible for coverage. There still needs to be so much education done. She points to the Biden administration's successes in boosting private insurance enrollment by investing in outreach workers That's the same thing that we're trying to do here with the Connecting Kids to Coverage initiative, really making sure we are using trusted messengers, she says. This is absolutely good news that these grants are going out. It is needed now a lot because we have this looming crisis with respect. The looming crisis is this: when the COVID-19 public health emergency eventually ends, states will begin to unwind a period of 2 years when no one had to prove they still qualified for free health insurance. That process, which is likely to be chaotic in many places, could lead to 6.7 million children who now have Medicaid losing their coverage, according to an estimate from the center. Some will lose coverage because they no longer qualify. Others will lose coverage because of administrative errors or missing documentation. It's clear to Alker that the federal health officials working on this understand that the pending crisis that could lead to millions more uninsured children is a really big deal, she says, and Tuesday's historic grant announcement is evidence of that. I think clearly the Biden administration has looked for the pennies under the couch to get this amount out this year. Society is not in good shape if the country's children don't have health insurance, Alker adds. A broken arm in a playground can mean financial disaster for a family. Missed wellness visits can mean missed developmental checks, routine immunizations or control for conditions like asthma. We have a lot of research to show that it's very, very cost-effective to provide health insurance to children. In the long run, this will pay many dividends back to society, she says. Insurance for children works a bit better than insurance for the rest of the population in the U.S. in 2020. About 94% of children were insured, thanks in large part to Medicaid and CHIP. Low-income families can get free, comprehensive coverage for their kids, and they can enroll at any time of the year.